name is Dr. Jobson, and I'm a board certified nephrologist. Some may call a kidney doctor. Welcome to my platform, Spare the Beans, where we talk about all things kidneys unfiltered. I wanted to first preface this by saying I am not an influencer, and my content is purely educational. Part of my mission is to empower people from all walks of life, backgrounds, and age groups to understand how to protect our kidneys from harm and lower our risk of kidney failure. My goal is to post weekly, but honestly, guys, I have a full time job and a large patient panel. And so always feel free to click like, share, and most of all, subscribe to ensure you're alerted to all my content across all social media platforms. Today, we're going to talk about diabetes. And some may have an idea what diabetes is, others might know something, and there are people who just don't know. Diabetes is when your blood sugars are high at levels that are considered unhealthy. There are different types of diabetes, which I won't go into more detail today, but it's important to know that diabetes is the number one cause of kidney failure in the world. Many people will be like, wow, yeah, it is true. Here is how it happens. When blood sugar stays high for years, it's like running sandpaper through the tiniest blood vessels in your kidneys. These vessels get scarred, and our kidneys have at least 1 million filter systems each. These filters start leaking protein into the urine, and that protein is called microalbuminuria. And it is detected years before you feel anything. Sometimes there are larger amounts of protein spilling in your urine that shows up like bubbly or frothy or foamy urine, some patients might describe it as, similarly to the top of a bear. And oftentimes, when patients are referred to see a kidney doctor like myself, they're told they have kidney disease on the background of diabetes. They say they feel fine. So let's use a scenario. Meet Jack. He's 52 with type 2 diabetes for 12 years. The doctors found small amounts of protein in his urine. He felt perfectly fine. But that protein was a warning sign because it meant we caught something early. There are many strategies in treating kidney disease, particularly for diabetes, but there are four main pillars, and this includes good blood pressure control, good blood sugar control, use of kidney protective medications, and at least annual monitoring. For patients like Jack who have incorporated these strategies, they have stable kidney disease and do not require dialysis. Every person who is at risk of diabetes, whether you're overweight, you have a strong family history of it, you consume highly processed foods, you're from the older age group, you have African Native American ancestry, you're Asian American or an Alaskan Native, you had been diagnosed with diabetes during pregnancy, have fatty liver disease, or you have been formally diagnosed with diabetes. These people need at minimum a yearly check of their kidney function. And this is the EGFR, which assesses the kidney's filtering speed, and the urine microalbumin to check if there's protein leakage. Depending on how many years you or a loved one has diabetes, you can get your EGFR and urine microalbumin checked more frequently. So share this with someone who needs it. Let's continue to raise awareness of kidney disease, which is rampant in our communities. And guys, don't forget to spare the beans.